the teens, but in my book I talk about this, what you're saying. It was like Humpty Dumpty, all the king's horses and all the king's men couldn't put it back together again. Yes.
One thing that might help you,
Can you stand up, please? Thank you. Wow.
one thing that might help you to think about it, it's helped me to understand it, is that just like in a seizure where the motor part starts to get out of control with a behavioral seizure. That when you think about it that way, I don't think we've been able to actually prove it because it would take a lot to be able to get it at that moment. But I think that it's, at least conceptually, would be a good way to think about it. But my question to you is, today, what would be different with the medical care system today? What would be the optimum of what we know? What would be the optimal therapy that we could possibly do? Or is it still fatal disease for bipolar I?
It's not fatal, but it's like this woman said, a long-term treatment is absolutely necessary to stabilize and to maintain. You can't get well in 3 or 4 days in the hospital. And you need chemotherapy. There has to be medicine. And the therapy that's not, the therapists that are not giving the medication, like the rest of us here, will help facilitate and be supportive. That it's kind of a combination. But I truly believe that my daughter did not choose suicide. I feel that her illness was her execution. She would never have done it. I spoke to her 2 days before. I was in Wisconsin, and I said to her, Pammy, I'm going to ask you a question that I never had the nerve to ask. I never even thought about it. I didn't think about it. I said, but do you ever think about killing yourself? It's a hard question for me to ask you, but I need to know. I'm up in Wisconsin going to North Carolina. You're in Florida with your father. He doesn't believe in bipolar disorder. He thinks you can get a grip. You know, just try harder. And believe me, a lot of physicians don't really know this. They don't, and they're treating it. That's the scariest thing, is there are a lot of people who are not psychiatrists or psychopharmacologists. Your primary physician can give you any of these drugs that they feel you have. It scares me.
Again, my question was, today, is there, what is the optimal therapy today?
Long-term treatment.
But that's cognitive and
no, long-term treatment is not just cognitive.
But psychopharmacologic.
Yeah.
And which medications do you
Oh, there's several. There's lithium still is one of them. Double coat, and you can name it. Lamictal, Neurontin. There's a lot of them. There's a mixture of them. Some people, and it has to be. It's like an art form. It's balancing it, and then sometimes when you just treat the depression a little too much, it blows it up into the mania. So it's really, and sometimes it works fine for months, and all of a sudden it doesn't work anymore. It works until it doesn't work. It's a biochemical instability.